You saw midwives, right?
I did. Yep. A CNM practice affiliated with the hospital.
Okay, so during any of your appointments, how often, if at all, did they bring up rupture to you? Because I'm just wondering because it seems like, it's a risk if you've
Mm-hmm.
had a section. How often is this really brought up? Some people, they said that's all my doctor talked about. And then others are saying, well, I didn't really hear about that.
Yeah, not much. So it was a midwife practice. They're all CNMs, and there was 8 of them in the practice when I was there. There might be more now. I'm not sure. It was pretty big. It was the biggest midwifery practice associated. In fact, it might have been the only midwifery practice associated with our big hospital conglomerate here in Rochester. And it's a big, large teaching hospital called and it's URMC, and there's URMCs all over Rochester, affiliated with the University of Rochester and then University of Rochester Medical Center. So I think that they're the only ones affiliated with them, and there was 8 of them. And they were the type of practice where you see different ones kind of all throughout your pregnancy. So and they do actually try to intentionally schedule you with different ones throughout so that on the day that you deliver, whoever, you've met all of them at one point so that you aren't just like surprised by who you get that day. It didn't perfectly work out that way. In fact, I think the one who was there on my day of delivery, I had not met. I was in labor for a while, so I had 3 different ones throughout the course of that time. There was one coming off the night shift when I got there, one who was there, and then one who was there the rest of the evening. They brought it up towards the end at like probably around 37 weeks. And they basically I would say twice actually. They didn't like overtly talk about it when they said this. They did tell me though, when they were talking through, do you want to do a trial of labor or repeat C-section? And they did right from the get-go tell me I was a great trial of labor. And they were definitely, I think, kind of steering me in that direction, just saying there's no reason not to really. You're a great candidate. You spaced out your pregnancies 3 years. You have 1 transverse incision. You're really healthy. Your weight is good. You like all these different things. They're like, you really don't have too much. And they said, you had choreo with your first one. And that's why you kind of needed the C-section. And that's likely not going to happen again. That's not one of those things that is likely going to happen in a subsequent birth. So they said, you're a great candidate for it. So she said, here's what we require for our TOLAC patients. So she did talk about, she said, we place an IV when you get there. And so she said real high level, she just said, and this is the lead, this appointment was the lead midwife at that practice. I really liked her. So she was always really giving pretty fair information and just letting me decide with things. But she said, when you get there, she said, we would need to place an IV in there. She just said, it's rare that complications happen, but when things go sideways, it happens quickly and we don't have time to do all of that. So she just said, you would need that, and you would need, we would want you to come into the hospital, she said, fairly early. We wouldn't want you to like show up pushing. And she just said, that she would tell me more as they got closer, but she did talk about those types of things. And she talked about continuous fetal monitoring. So I will say in that, like, midway through my pregnancy, when we started talking about what type of delivery I was hoping for, that particular midwife, who is not the one who attended my birth, she did kind of lay that out there, but she didn't specifically talk about rupture. She just talked about, this is what we would need to do in a TOLAC, and talked about, if something goes wrong, it goes wrong quickly. So I had heard a little bit about rupture before, not much. I didn't pay attention to it too much. I had heard about it a little, and I assumed that's what she was talking about. And then at 30, somewhere in my later 3rd trimester, when you get Group B strep tested, I was Group B strep positive. So it got brought up one other time then, because they did say that they were going to have to push the antibiotics when I got there and give me the 3 different rounds of it, if I'm remembering correctly, of antibiotics throughout my labor. And she did just talk about, again, reminding me, when you come, you're going to have to get the continuous fetal monitoring. And she just said, we try to get the ones where you can move around. So she said, there's like 5 of them at the hospital, or 5 of those at the hospital. So she says, I try to get those for my patients. And so I'll try to do that for you. And then again, it wasn't explicitly about rupture or anything like that. She just kind of talked about, these are the things we need to do. And when she did talk about complications, she just said it's exceedingly rare. Severe complications are very, very rare. And she didn't really go into them at all. Any of the midwives, none of them really were like, this is what a uterine rupture is. This is what happens if you have a uterine rupture. This is what the potential risks are. Like no one discussed like, oh, if your uterus ruptures, you could potentially lose your baby, have a baby that had a brain injury, have a hysterectomy, have significant blood loss. It was just kind of like, it's an emergency and we try to get to it quickly. And that's kind of how it was discussed.
So they didn't talk to you about specific numbers like this, it's 1 in this, or no, not at all. Okay.
Not at all. No.
I was really wondering about that. When a lot of people who are dissatisfied with the care that they're getting, normally when they're going and trying to attempt a VBAC, they're upset with the care because the doctor brings up the risk of rupture and gives actual numbers.
Mm-hmm. Yes. And it's interesting. They never did bring it up. I found that between the providers that I saw there, half of them, they all practiced they practiced evidence-based care. They were affiliated with the university teaching hospital. They were partnered with OBs who were at the hospital. Like the OB was at the hospital there. That was partnered with them that night, especially because there was a TOLAC patient there. They are very much like science minded and they do follow those things, but I could tell about half of them truly believed more in the business of being born model of midwifery, even though they knew science and they were CNMs and they definitely had a natural birth without an epidural is beautiful. Like half of them were kind of anti-epidural. That got brought up. So that got brought up much more in my actual appointments than rupture or anything like that. A lot of times it was talks of pain management. I would very quickly be able to ascertain like what their views were on it just by the way they presented it to me. So more things like that, definitely more, women have been doing this for thousands of years and your body was made to do this. And there was a lot of that in there, despite them being CNMs and having a high level of credentialing and everything like that. So, but like the lead midwife of that practice, who I thought was incredible, like I wish she was there on that day because I actually think some of my outcomes, if I tried for a TOLAC and my body was going to rupture, like my uterus was going to rupture, it was going to rupture, but like certain aspects of kind of me articulating it and not getting taken seriously and kind of them having the midwife who was there that day, I felt had a more, your body is not going to rupture, you're not going to be it type of approach and type of mentality going into it. So that practice was definitely like 50-50, where half of them were, I could tell, had a more natural, idealistic view on birth. And for what it's worth, I think, and I know we've talked about this before, as a CNM practice, yes, of course, they saw me as a TOLAC patient, which bumps me into the high risk category. They see people who have, certain conditions that put them in high risk, like even just obesity and things like that, anything that could bump up your risk factors. But they're still overall not seeing the most at-risk patients. So they are getting outcomes in general. They are getting a little bit more rose-colored glasses with certain things because they really aren't taking on tons of really risky patients. And I know that hospital that you deliver at, again, we do have a really good hospital system here, and URMC, like if you have certain things, they want you to go to a more high risk OB. So they're not seeing, so I think it allowed them to kind of maintain some of those views because they were getting a lot of people who don't have super high risk factors anyways. And so they weren't seeing it. So I do think that they kind of viewed things that way.
So did you see a doctor at all during your prenatal care?
Nope, I didn't see a doctor at all. What's interesting is my primary care physician did end up seeing me a couple of times. I had a regular routine physical during the time, and he detected that I had like a heart murmur and some other things. And so he ended up, and he said that sometimes those happen in pregnancy, and he said sometimes they'll go away after. He actually knew that I had struggled with some depression after the birth of my first daughter. So I have a really hands-on involved primary care physician in general. And he actually saw me several times, like probably 4 or 5. I mean, in the scope of how often you typically go see your primary care physician, he saw me a handful of times for different, like related, but not related to my pregnancy, but everything's related when you're pregnant, so to speak. He did see me for like some follow-up pieces just for the continuity of my care and just making sure things were staying okay while I was pregnant. So otherwise, if I didn't have a doctor who's as thorough as him, I probably wouldn't have seen a doctor at all my whole pregnancy. So no, I just saw the CNMs. I saw them on the same exact schedule, though, that you would see OBs, and I had all the same screenings done. You know, I was tested for, did the glucose testing, the gross drink and all of that, and the blood work and the blood work timeline, and, you know, had all my urine screened each time I showed up, and they screened me for Group B and then immediately told me that like they'd be following that protocol related to Group B strep. And I was so mad when I had that. I was like, oh man, I didn't have it with Peyton. So I did with my second, though. So they did do all that, but no, I didn't see any doctors throughout my care, just CNMs.
So what would you think between the two children for pregnancy and birth? What's the difference in your view, looking back at them? What do you see that was kind of different care, different how things went? I
had totally different providers. So the first birth with my first baby, my daughter, I had an OB for my whole pregnancy, and I would see an NP sometimes, and then I would see an OB for some of my appointments. It was very similar in what they were doing. I will say that my CNM appointments lasted longer. I liked that. I liked that they took the time with me. That was something that was appealing to me. I definitely wouldn't say that I went into my second pregnancy filled with woo, so to speak, but it had hints of it because I kind of like had a difficult recovery with my first pregnancy. Looking back on it, everything they did, they followed and did and helped me with, and in the wait timeline in which they called the C-section and how they handled my care and her care was all fine, and it was all science and evidence-based, and it was the right thing to do. And I actually think the fact that they did the C-section when they did it with my daughter was good because we had choreo and she still had to get the antibiotics and everything. And they kind of prepared me like, well, she might have to be in the special care nursery which was like what they had at that hospital. They said for, like a week or so. And she was able to, she did much better, and she was able to be in my room fairly quickly. So looking back, hindsight, oh my gosh, my care was fine under my OBs. My OB was a little less warm and fuzzy. It was a little more like, all right, I had to wait in the waiting room forever to get into my appointment. And then they spent 5 minutes with me and and on I went. And where I liked the fact that my midwives, the CNMs they spent a lot of time with me. They were so thorough in their explanations. They asked me how I was like doing overall. Like it seemed like, so I really liked that experience. And that piece, I will say, like that was part of it for me. So I really went into that whole second pregnancy being like, but they spend more time with me and they listen and they answer my questions, and I don't feel like I'm getting rushed out the door. So, but looking back on it, like, yeah, my care and everything, they were running the same screening and doing those things. And maybe it was just that particular OB was a little abrasive, but I had good care and everything.
So she had different things going on with her afterwards. So she had to get a little bit more special attention afterwards.
Yeah.
How are you doing afterwards you ended up with a C-section, all the stuff
Mhm.
physically and mentally that your little one had to go get a little bit of special care, even though it probably wasn't NICU, right? It was just special.
So the hospitals, so yes, I'll answer that in a whole. So the hospital that I delivered at with my first baby was adjacent to the larger teaching hospital, and they're both affiliated. However, they do still have certain things that certain funding, certain philosophies, certain ways in which they provide care that are different. The hospital that I delivered my daughter at had and I think still does the baby friendly hospital accreditation. And so I had a very hard time with all of it. So my labor was rough. My choreo, I was so sick towards the end of labor. I had a fever of like 102. She had a high elevated temperature upon being born. I was shaking. I was vomiting. I was feeling horrible. Like I just felt like I had the flu in labor. So choreo is not a lot of fun. I think it happened because my water had broken, prior to ever experiencing any labor. So, labor started after that, and it was just a long time. And she had pooped inside. So, there was all of that that was factored into it. So that was a long time for my water to be broken, and the meconium. So she had aspirated meconium as well. Not super severely, but enough that, so she was sick when she was born, and I was sick, and I felt like a bus had hit me. My feet and my whole body was just like swollen everywhere. I just felt awful after my first C-section. And then even with her getting basically her care that was consisted of in the special care nursery, which yes, it's not a NICU. It's really just where they need a little extra care. It's not to the level of like an actual NICU. She had antibiotics basically and stuff, and she was a little jaundiced too, so they popped her under the light, but nothing super crazy. And it was allowed where like they brought her back to my room to feed. Now I had read like all the books with that, and I was like, I am breastfeeding. Hell or high water. Like I'm breastfeeding, this baby is getting my boobs and nothing else. And I remember going into there being like, okay, so committed to it. And I did end up doing it, but my body just felt so horrible. I could barely, walk after my C-section. I was in a lot of pain. And then I had certain nurses who would try to like tell me that I shouldn't take certain medications, like, oh, you should really try to wean back on how much of your pain medication you're taking. And then I had some that were like, take it on a perfect schedule. And then I had a lactation consultant who came in and who was like, absolutely do not give that baby a pacifier. And then the special care nursery was giving her one, and they were like, that lactation consultant is nuts. Like, good luck with your baby not having a pacifier. Enjoy. And I was like, can everyone stop giving me mixed information and coming into it? And not only was it mixed information, it was like guilt and shame inducing information. Like, no matter what you pick, you're wrong. And so I was exhausted. They kept bringing her to me. And despite the fact that I was like, I just need to sleep. Like I had been up, I had like a 20-hour labor. I had surgery. I had not slept. I felt like I was being tortured, and they just kept bringing her to me to feed hour after hour after hour. I was sobbing. Like she wouldn't latch. My milk hadn't come in. I felt terrible. And there was one lactation consultant who came in, and she was a nurse, an RN as well. And then she would do certain shifts as a nurse and certain shifts as a lactation consultant. She came in at one point and just told me that, so at one point I was so exhausted, and I just said, can you please just take her to the nursery? And like, my milk is not in, and I can hear her like little tummy grumbling, and she's miserable. Can you please just give her a bottle? And I'll try breastfeeding again, but like, can you just give her a bottle? And the special care nurses were like, yes, of course we can. And they were so nice. And sure enough, she guzzled that formula down because she was hungry, and she did really well with it. And then actually her latch was better after that. I think probably because she wasn't like so starving. She came back, and like one of the lactation consultants found that overnight she'd come for the morning shift, and she found out that overnight I'd given the baby bottle, and she was like, well, you'll never successfully breastfeed if you keep doing things like that. I can't believe you gave her formula. Like, you're gonna, and I know I had totally taken their like exclusively breastfed notch out of their checklist for baby friendly. I know that that's part of it. And I had given the baby some formula. She had several bottles while she was there. And then I went on to breastfeed her exclusively, probably for like 6 months before I started to do a hybrid approach. And I think I weaned her overall at like 10 months. But all that's to say is I hated every bit of that hospital stay. I felt like I could not, like that they interrupted me constantly and made me feel bad and were never letting me rest and constantly putting, and I was like, how is this how we care for mothers after they've given birth? Like, this is terrible. So I wanted everything to go differently that second time, because sure, of course, it's not as traumatic as when something really terrible happens. It's not as traumatic as when anything like a severely injured NICU baby or a loss of a baby or anything like that. But for my frame of reference at that point, and I still stand by it, it still really sucked for me at that time. And I felt horrible and my recovery was bad. And I just wanted nothing to do with that the second time. So even though my OBs and all of that, none of them were to blame in any of it, I was just like, I want none of that. So whatever it takes for me to get a different experience next time, I really want to do it. So I did start subscribing to some of the more like, you should definitely have a trial of labor and your recovery is going to be so much better if you don't have to have a C-section the next time. And really, and I did buy into the fact that more of it was in my control than I thought. So I'm like, you know what I'm going to do? I had put on like 55 pounds with Peyton. And I only put on like 20, my 18 or 20, my second pregnancy. And I stayed really fit. And so I told myself, I was like, I'm going to eat really healthy this leading into my pregnancy. I'm going to get to a good weight before my pregnancy, and I'm going to be exercising. I'm going to eat, like I'm going to make myself these healthy smoothies all the time. And I'm going to basically make my body like the perfect place to get pregnant and carry a baby. And then I'm going to do all the right things throughout my pregnancy. And then, so while, I was perfectly content to be like, yep, I will get the IV. I'll have the continuous fetal monitoring. Yep, I'm open to these different things. I also really did want a different birth experience. And I did subscribe to the idea that I was in much more control than I really was. So I thought like, if I just do these things right, because I read it everywhere, and I had a VBAC board on my Pinterest board that I would like pin things that were basically like, yeah, if I just do these things, then it's going to be so much easier. And one of them did include hiring a doula. And that's where I did get into, I wasn't sold, nor was my husband at the time, sold on the idea. He's like, we are not paying for, that's crazy. Do you see how these, and then there was one who was in a mom's group I was in who said, I'm taking doula courses right now. I'm looking to take on free clients for it. Like I have to have so many. And I said, sure. So I did end up having a doula. I didn't pay for them, but it was someone who was, and I did think that could impact my outcome as well. I thought, well, if I have a doula and maybe I can wait longer till I get pain medication, or maybe I'll just forego, which is hilarious. I would never forego pain management, but I thought for a minute that I might. And I was like, maybe I'll forego that and maybe I'll do this. And I just thought that I had, like, if I just check the boxes that these little Pinterest graphics keep telling me that I can just check these boxes and get a better delivery than that first one, I'm going to do it. So I really did. And I stuck to it. I was very healthy throughout my pregnancy. I exercised 5-6 times a week. Sometimes I took miles and miles walks every night. I really my pregnancy was so much easier. And I just put on like 18 or 20 pounds and I felt really great. And I ate really healthy. And I set an alarm to take my prenatals because I certainly didn't with my first. I would forget and take them like once a week. So I did all those things. And I was just like, you know what, so I did. I subscribed to the idea that I was in a lot more control than I was, which I think is a very, very common theme for pregnant people who are looking for different outcomes. And like, you wonder like, okay, well, how can they fall so deep into this? And it's like, well, if it was crappy enough, if it sucked enough and they want it differently, you're going to seek out information that's going to tell you that you in fact have more control than you do. And it's going to tell you that if you just do these things, you can have that outcome.
I have a question about that, since you were doing all of that. And when you had your prenatal visits with your nurse midwives, did they ask about that? Did you tell them about that? Did you communicate a certain, shall we say, attitude towards this upcoming birth that they might go, oh, yes, we can, you're working so hard. We can see that you really want this.
Mm-hmm. I think so. And they also were very like, looking back on it, there was a couple of them, and they were a couple that were more on the natural side of things. Like, oh, and I actually had a couple of them. And I mean, this wasn't just them like hearing my version of events and taking it for what it was and whatever. They, I mean, had my medical charts and read everything, and they knew why I had, and I'm sorry, choreo is a very legitimate reason to have a C-section. It's a very like normal reason for one. And they were kind of like, oh, I bet if you had just like some different care, you wouldn't have even needed that C-section. I had a couple that said that, and I was like, well, I mean, and I remember at the time being like, you're probably right. But looking back on it, I mean, even in that moment, my OB had said kind of like when she came in and was like, hey, Megan, I'm thinking we should do a C-section. She did say, she was like, we could try it a little longer. Like we could try to go another hour or two and just keep an eye on the baby's vitals, and we can see, and maybe you'll dilate. And she's like, you're kind of stuck at 6, you know, maybe you will, and maybe you'll reach that point. But she was like, I don't know, her heart rate is dropping. She was like, I can tell you're not feeling well. And like, we could just, you know, I don't see it really ending in a way outside of a C-section, and I'd rather just save you feeling crappier for longer. And so she was very kind in how she handled that. I think like I attributed a lot of my recovery to just like, well, the whole thing is broken because this recovery was terrible and I hated it and this was stressful to me. So I was like, anybody who was affiliated with it, even though looking back in hindsight, and like, oh my gosh, no, that OB was fine, but my OB was canceled. I was like, everyone's canceled. So, because that was stressful to me, so I couldn't separate any of it out. So with the midwives, they did a little bit to that. There was a couple of them that were like, you probably wouldn't have even needed a C-section if your body was just allowed to do its thing like a little longer, which I do think is a little suspect, being like, it's choreo. I mean, no, not really. Or your baby could have continued to really struggle because, so I don't know. I think that's interesting looking back on it. But at the time I was kind of like, yes, you're probably right. And then they did. So when they saw that I was, you know, they asked, did you hire a doula? And I said, yes. And they were like, great, we love doulas. So, I mean, they knew I wanted to not have a C-section again. I never pushed back on any of the things. Like, so I wasn't like, why is that necessary? Do I really need continuous field monitoring? Can I just have intermittent monitoring? To me, I was kind of like, sure, whatever you're saying I need, that's fine. So I was probably less pushy about the natural side of things than some patients that come in there, because I know that they definitely probably have patients that are averse to like basically just want them to attend their hospital birth and that kind of be done with it and not have much else in the way of care. I wasn't to that degree, but I do think I made it clear that I had a very negative experience, and they were sympathetic to the fact that I had, you know, a previous birth experience and hospital stay that really wasn't how I liked it, how I wanted it to go. And they were at least, you know, aware of that. So they knew I wanted a trial of labor. They knew that I would be disappointed if they had said right from the get-go, I think, you know, you should have a C-section. So they were definitely, and they were very much telling me frequently at all my visits why I was such a good TOLAC candidate. So they did tell me that quite a bit, and they did comment on how, oh, your weight is perfect, and you know, and your blood pressure is the best blood pressure we've had all day, and things like that. And they just kept saying kind of things like that. And they were very encouraging of the fact that I was taking good care of myself and things like that. And they did at times, to kind of get where you're going with that, Ange, they did definitely play it up as like, you're doing all the right things, as if like, yes, all of those things are contributing factors. Like, you're doing all the right things, but really that's the case. Me caring for myself and taking good care of myself while I was pregnant would have been good for me if I had a C-section too. It's just good to take care of yourself in general. It's not necessarily like related to a certain birth outcome. It's just like, sure, yeah, it's good to take care of yourself.